Today, we're discussing how to do lip filler with cannula, and of course, a whole bunch of other stuff as well. Hi TLCers, today we are discussing lip filler with cannula. If you've seen any of my previous videos, you will have noticed that we can do lip filler using either a needle or a cannula. Why would we choose one over and above the other? Well, it depends on what kind of problem it is that you're trying to treat. So if somebody has got quite a narrow lip and I want to widen it slightly, then I'll use a cannula rather than a needle. You can do it with a needle, but I just think that the overall effect is nicer if you use a cannula. Also, you get less swelling when you use a cannula as well, which for some people can be quite important. So if you're going out in the next few days, you really don't want to be having a lip augmentation done using a needle because you're going to swell, and some people swell an awful lot. Obviously, even when you use a cannula, there is still some swelling there, but it's just not as bad as it would be if we were doing it with a needle. You can't really compare the two though, because it's really apples and oranges. The result that you get from using a cannula will be very, very different from the result of using a needle. And you can't do certain things like augmenting the cupid's bow very well using a cannula, for example. You can't enhance certain parts of the lip border using a cannula. So that's why it's important to be able to use both, because we need to. Okay, so let's take a look at this patient. So what did we do? What did we notice? Well, you can see that she's lost a little bit of volume underneath the eye, looking kind of a bit tired, a little bit frazzled. Got some subtle horizontal forehead lines here as well. You can see we do have a little bit of a nose to mouth line going on there. Nothing too horrendous, but certainly something that we could try and improve. And there's a bit of volume loss right there next to the nose. I would say that her lower facial third is probably a wee bit short. So if you remember, the face is split up into thirds and the bottom bit should be obviously 1/3. It's just a little bit short. So if we could just extend that slightly, I think it would make her face shape a little bit better. She's got great cheekbones already, really good light reflection here, lovely shadow under here, but you can always improve, guys, always, never stop. So the first thing that we did was use some Botox to the frown lines, the forehead. We then moved down to the chin and this muscle right here to stop the mouth corner from pulling down quite so much. And we also did a little bit of Botox around the crow's feet as well. Because she's got a beautiful face shape already, all we need to do is just replace some of that volume that we all lose when we age. So the first thing that we're going to do is start in front of the ear, and we're just going to fill this area here using a cannula, and this is some hyaluronic acid right there. And you can see that what this is doing is just gently revolumizing this area, which has the effect of lifting up the tissues on that side of the face. The next thing that we're going to do is the angle of the jaw. Now she's already got a fantastic angle of the jaw, but you know, if you can make something better, then why not? So again, we're using a bit of hyaluronic acid down here just to square that up slightly. Moving on down to the chin now, we're going to use a cannula across the chin crease and the marionette region to improve that whole area there. And again, this is using hyaluronic acid. Next thing, we're going to have a look at the base of the nose. This has an indirect effect on improving the nose to mouth line. Again, we're using a cannula in this region. The last thing, this is something that I find that I'm doing more and more of. So we're doing some dermal filler here into the forehead, and that's because she's got a little bit of an indent in the forehead, and it looks much more youthful and healthy if you have a rounded, smooth forehead rather than a slight indentation. So let's get to the main reason why you're probably watching this video, and that's to do lip filler using a cannula. So she has had some lip augmentation done before, always with a needle. There are many different ways that you can do lip augmentation. very common way of doing it is to use the needle along the border of the lip, the vermilion border, and you put the filler in there. Another way that people use is to go directly into the body of the lip, that's the pink bit. I think that was much more popular a few years ago. I find that when you directly inject the body of the lip, it can almost make it look like the tissue is being dragged down, and instead of it flipping the lip up, it almost pulls it down. So I prefer not to use that method. I do still inject the body of the lip, but actually I do it from above. You might also have seen this tenting technique that some people are using when they go in directly above the lip into the body. I personally don't like that technique because you don't know where the artery is in there. You can do it, but you have to feel from the inside with one finger so that you're almost coming out of the other side of the lip. I'll do a video about that one day and I'll show you exactly what I mean, because I know it's kind of hard to conceptualize. Anyway, we're using a cannula right now to give a bit of volume to the lip, and you can see that what it's doing is just slightly widening it. And of course we need to do the upper and lower lip in order to keep them in proportion. If you just do, say, the upper lip without doing the lower lip, which sometimes people do ask for, it looks really weird. So even if you're putting like a very small amount of filler into the upper lip, I would often balance that with doing the lower as well, because if you're just doing the upper on its own, it will throw your ratios off and it won't look right. The last thing that we're going to do is use a cannula to treat the under eye area. And what we're doing here is we're actually using a product which contains additional vitamins and minerals called Teosal Density 1. And this is really good for your skin health. So it's not a traditional filler. The hyaluronic acid that's inside is not cross-linked, so it's single chains, and it's used as a biostimulator. So we're trying to produce more collagen in that area there. Now, unfortunately, our after picture here was taken on the same day of treatment, so our patient does look a little bit frazzled, so sorry about that. The next time that she comes in, I will definitely take a whole new set of pictures to show you, and I'm sure that you will see that there's been an improvement in her skin quality and texture. But we can't really see that right now because it was literally just half an hour since we did the initial procedure, so I'm sorry. Okay, so let's have a look. So first of all, let's just check out the forehead. So you can see that these little horizontal forehead lines there, they're not quite as prominent in the after picture. Of course, her Botox hasn't started working yet because it's literally half an hour since we did the treatment, and it takes about 2 weeks for it to reach its maximum effect. So we're not going to see much there, but what we can see is an improvement in the contour of the forehead. So it has changed the light refractive properties of the skin there, just a wee bit. Moving down, if you look at her overall face shape, you can see that there's much more of a V shape there in the face than there was beforehand, where it's just looking a little bit more square. So do you see what I mean there? Because we've got this cheekbone prominence. We did have that before, but it's just tidied up a little bit. We've also augmented a little bit here as well to relieve the nose to mouth line. The lip, obviously the lip is swollen, but that's just because we've only just done the injection. So you see this sort of redness, which is characteristic on both sides there. That's normal after you have a lip augmentation done. It's normal for it to look like this. I'd say it probably takes around maybe 5 days for that to settle down, and it will end up probably reducing by about 1/3 there. Looking at the under eye region, because this is a biostimulator that we used, you're not really going to see too much there, because again, that takes about 2 to 4 weeks in this area to see a good improvement. So what you will see is improved hydration in the eye area, and there should be an improvement in the colour as well when everything's settled down. So I promise, as soon as she comes back in, we will take another picture and I will show you her true afters, not her immediate afters, because it's not really a good comparison between the two. The last thing that we're going to do is use some Aqualix underneath the chin. Now I have used this in another video before, and that is a fat dissolver. So you inject it to dissolve the fat in this area to improve the jawline. With that, there's quite a bit of swelling, and that lasts for probably at the most is around 3 to 4 weeks. You'll have some residual swelling, but it's at its worst for the first 3 days. But the great news is once that fat is gone, it never comes back again afterwards. So again, as soon as I get this patient back in, I will show you her jawline as well, and we can see the results of the Aqualix. Sometimes you have to do Aqualix a couple of times to get good results. Okay guys, so that's it for this week. If you've had lip augmentation done before, particularly with a cannula, let me know what you thought about it in the comment section. I'll see you guys next week, and in the meantime, don't forget to like, comment and subscribe.